Globally, universally, the world needs better health care, more access to health care. The Estella Byrd Whitman Center is a medical facility right in the heart of the community, and it's there for anyone.
The Estella Byrd Whitman Community Health Center is a neighborhood medical home that was established to provide care to the underserved population in this community. We provide here primary care, and we work with different community partners in the area to provide the specialty services like career development, behavioral health, and dental. One of the founders made a promise to her grandmother on her deathbed that she would return back to this area and provide care to those who just lack access to medical care.
I had told my husband that I had promised my grandmother that I would create a medical center. We moved to Ocala and we started our journey to create the Estella Byrd Whitman Wellness. This bench that I'm sitting on sat on my husband's grandmother's house in Coconut Grove. And my husband says, you know, when I pass away, I want this bench to come over to that clinic so I can see everybody that comes in and everybody that leaves. He passed away in 2013. His services was in December 2013, and the city of Ocala actually came to the service and they announced that they would continue this project for us.
This neighborhood specifically does not have access to a lot of resources, so it's one of the census tracts that is continually under-resourced. I work with the City of Ocala Recreation and Parks Department. Part of my job is to make sure that this community has wellness and fitness programs, and we have athletic activities, which is how I began to interact with the center. This center specifically provides a lot of health care and wellness resources to people who transportation may be an issue or finances may be an issue. It provides access.
West Ocala has been deemed federally as a medically underserved area. There is either no or very limited access to primary care.
There's not many options in this area. There's a new hospital just got built here in West Ocala. Until then, you know, a lot of people struggle to get health care. On the other sides of town, on every corner, there's a health clinic, but in West Ocala, it just hasn't been.
This community clinic resides in Northwest Ocala. We will see anyone from anywhere. If you can get to the location, we will see you. We also have telehealth visits that we can provide to patients if they're unable to come into the clinic for one reason or another. As well, we do have a couple of our providers who will go out and make home visits as necessary. With the federal government recognizing this area as a medically underserved area, that pretty much means that the federal government has said, you know, this is an area that seriously lacks access to primary care. We're trying to remove as many of those barriers as possible.
I had an incident and where I wound me up in the hospital. And so from the hospital there, they recommend me to this place. They very explain to you everything about your situation, your health and everything. That is very helpful if a person acknowledges, don't know the extent of the conditions and everything. They explain it to you where you can understand everything.
Prevention starts with education. And the more that you educate people, the greater your chances are of people actually following through with the regimen that the provider puts in place. If the provider says, you know, you've got diabetes and you need to monitor your A1C, we're going to be watching these things. Well, the provider's job is to come up with that treatment plan. But as an organization, our job is to educate them as to what those things mean. Understanding what is diabetes, what are the things that we need to be worried about. I do not believe that people can be successful in obtaining their healthcare goals without first understanding them.
We can prevent them from getting into the hospital. We can catch things early. We can treat their diabetes, treat their blood pressure so that they're not in a crisis situation landing in the hospital. That is a humongous bill for them where we are pennies on that dollar. We take walk-ins, we take appointments, new patients, and hospital follow-ups. We do a lot of primary care, diabetes management, high blood pressure, thyroid issues. We have some wound patients that we take care of. We don't do any pain management here, but we can help with labs and physicals. We have a couple of resources for prescriptions. We use a company called Interfaith. We send a prescription to Biddings, and then Biddings gets a voucher from Interfaith in order for us to get medications covered.
We are fortunate enough to partner with the Marion County Hospital District, the Community Home Project, the Community Paramedicine Program, Marion Senior Services, Interfaith, Freedom Clinic. We are really very fortunate, and we are always looking for more partners. This issue is not an Estella Byrd Whitman issue. It's a Marion County community-wide issue. Everybody really has to join together. Marion County is a strong county, and I think together we can really make a huge impact.
The work is good, the people are good. There's so much benefit from a center like this, and I think sometimes people think they have to move from their neighborhood to find a better one, but really you should invest in the neighborhood that you're in. There's so many people even outside this neighborhood that are impacted by the work that goes on in here.
People can come here, we can be a resource. If I can't figure it out, the team absolutely will figure it out. They will find a way to get medication, and they will find a way to get scans and consults that we need.
All of our community partners are working very hard to meet the needs and to resolve the issue of barriers to healthcare. I really hope that this organization continues to grow and that we can help as many people as possible.
So many people live in the community or they're healthcare workers and they come into the community, but they don't even know that the center's here. We want to make sure that it's utilized by the people who need it most.
If you can't afford the cost of medical, it's hard to find coverage. So a place like this in the neighborhood, it helps out everybody.